Hi everybody, and welcome to the newly released Beating Diabetes podcast with Dr. Michele. This year the podcast will be focusing on all things diabetes. And as your host, I'll be recording solo episodes which will cover some of the most common questions I'm asked as a physician, such as, what can I eat as a diabetic? How can I lose the extra weight that I've put on recently? Is it really possible to reverse type 2 diabetes? What can I do to prevent my children from getting diabetes since it runs in the family? And more. I will also be coaching patients and clients live on air and conducting interviews with other diabetic experts. I hope you enjoy the show. Someone asked me today, why is it so difficult to work with diabetics? And my answer was, it's complicated. There are so many things to consider when working with a diabetic patient or client. Diabetes affects all areas of your life. It's not just about the sugar. You have to consider everything you eat and drink. Diabetes affects your eyes, the fine muscles of your hands, the feeling in your feet, your kidneys, your heart, your circulation, your moods, your sleep, and your mind. It can cause dementia, blindness, numbness in your hands and feet, kidney disease. It can lead to gangrene and amputations, and it can cause depression. So when I hear of health coaches and other healthcare professionals who are working with diabetic patients and clients, but they haven't been trained specifically in treating all these areas of diabetes, I wonder if they're in over their heads. It's not easy. It's like taking one step forward and two steps back much of the time. I've been doing this work for over 20 years. I've seen it all with my patients. I've seen the denial, the heartbreak, the struggles, the devastation, the loss of limbs, the loss of life, and I've seen the triumphs. I've seen people overcome their diagnosis. I've helped my patients and clients reverse type 2 diabetes. I've saved limbs and toes from amputation. This is my mission, by the way, to help people reverse the diabetes so that they don't end up dying from it or losing a limb. It's possible, but you have to work with someone who knows what they're doing. You have to do the work, and you have to work with someone who knows what they're doing. You can beat type 2 diabetes and borderline diabetes. You really can. You may need help, but you can do it. I'm tired of people steering you the wrong way. I'm tired of hearing my patients report that their primary care physician didn't explain anything about diabetes to them, didn't tell them what they could eat, or give them at least a handout that they could take home to read about it. Many of my patients are reporting that their primary care doctors just told them not to eat sweets, not to put sugar in their coffee, and to lay off of the desserts. I ask them, what about bread? What about other carbs? What about healthy fats versus other fats? Did they explain any of that to you? Usually the answer is no. I ask them if their primary care physicians have explained neuropathy, retinopathy, and nephropathy to them. Again, the answer is no. We need to do a better job of educating our patients. We should be steering them in the right direction, giving them resources, checking in with them more often, and helping them, not just sending them out into the world with a prescription for oral hypoglycemics or insulin. We can do a better job, doctors. And you can beat this. You just need help, direction, a leader, and the willingness to do the work. I know you can do it. And I'm here to help you. So let's get started. Patients, clients, and family members want to know, is it possible to reverse diabetes? In the not too distant past, a diagnosis of type 2 diabetes was devastating, and doctors told patients it was a chronic condition that could be managed, but could not be truly cured. Today, research is showing something different. Individuals with a diagnosis of either prediabetes or type 2 diabetes can, in fact, reverse the condition and reprogram their bodies to use the naturally produced insulin to control their sugar levels. What most doctors don't tell you. Exercise, careful choice of foods, and losing excess weight are all components of reversing a diagnosis of type 2 diabetes. For many doctors, the natural option is to prescribe insulin or oral agents and instruct the patient to simply show how to manage their blood sugar, rather than getting to the root cause of the insulin resistance and the weight loss resistance in their body. The reason that many doctors don't tell patients this, despite the current research indicating it is possible, is that it is a lifelong commitment. The eating changes, the increase in activity, and the monitoring of weight has to continue, and many doctors simply don't see their patients capable of sustaining the lifestyle choice. Many doctors are also behind the times when it comes to current diabetes research. They may not be effectively working with patients in the pre-diabetic stage to assist patients in understanding the role that excessive weight, high carbohydrates, and refined sugar intake have done on their bodies. Studies by the Center for Disease Control on dieting and weight loss show positive results in naturally managing fasting blood sugar levels, which is a key indicator in the diagnosis of prediabetes and type 2 diabetes. Patients that are committed to healthy eating and exercise and who are able to sustain these changes can and do lose the weight and keep it off, can return their blood sugar levels back to normal levels without the use of insulin. While not all people will be able to control their diabetes through diet alone, the lack of information provided by doctors may be limiting this valuable research to patients. By managing eating, exercise, and weight, they can not only prevent the health issues associated with the disease, but continue to live an active, healthy life without the need for insulin and constant blood sugar monitoring. So let's get on to 2 simple things you can do now to start reversing diabetes. Well, the key is changing your diet. People with type 2 diabetes or those diagnosed with prediabetes can control and even reverse their diagnosis through simple changes in their lifestyle. Adding more activity and carefully managing the foods you consume to lower your blood sugar can have dramatic effects and limit your future health risks. 2 of the biggest factors for developing diabetes include excess weight and lack of physical activity. Of course, genetics also contribute, but genetics is not something that anyone can control and plays a much smaller risk than was originally believed in type 2 diabetes. Food choices are within your control, however, and there are some great tasting and healthy options that cannot just limit diabetes, but actually turn back the clock and get your body responding properly to the insulin it produces. So here are 2 simple things you can start doing today to begin the process of reversing diabetes in your life. Number 1, choose low glycemic foods. Carbohydrates are the biggest cause of sudden spikes in blood sugar. By learning how to choose from low carbohydrate foods or foods with complex carbohydrates that digest more slowly and avoid those blood sugar spikes. The glycemic index is a simple way to determine if food is high in carbohydrates. Anything over 70 on the index is high, which means it's digested quickly and creates a spike in blood sugar. Anything less than 55 is considered low, meaning it's a healthier carbohydrate that digests more slowly to release blood sugars. Low glycemic index foods include many whole grains, green vegetables, sweet potatoes, whole wheat pasta, and all of the non-starchy vegetables. Most fruits are also low glycemic index, but it's important to choose whole fruits or try juicing at home and to use the pulp to keep the low glycemic index rating. Processed foods, baked sweets and desserts, prepared juices, and most types of prepackaged foods have a very high glycemic index and should be eliminated from the diet. There are alternatives to these high sugar, high calorie, and high fat foods, and you will soon find tasty alternatives that are every bit as good as those unhealthy options. Number 2, portion control is essential. Too much of even a healthy food isn't really healthy anymore. Instead, choose a balanced diet that has lots of fiber, limit simple carbohydrates, and lower glycemic index foods, fruits and vegetables. Try to use a general guide of half of your plate with low glycemic index vegetables per meal, and choose lean proteins and limited healthy fats to lose weight and manage blood sugar levels. By eliminating a few foods from your diet and adding some new healthy options, you can manage your type 2 diabetes and prediabetes. Talk to your doctor and develop an eating plan that works for you, your lifestyle, and your current and future health goals. And if you don't have a doctor that has time or is not willing to work with you on this, you can find someone like a health coach to talk to. So that's one of the things that I've been doing, is working with diabetics in groups and helping them with this, because many of the doctors, and I'm talking primary care doctors, are overworked right now with the way the healthcare system is in our country, and they don't have the time, or they don't spend the time with their patients going over these issues. Some of them rely on their nurses to do it, but as you heard from what I was talking about in the beginning of the episode, most of the patients are not getting the education that they need on the dietary aspects of diabetes. They're just being told by their doctor what not to eat. Don't eat sugar, don't eat desserts, don't put sugar in your coffee. But they're not told what can they eat. And they're not given recipes and handouts and shopping lists and meal planning tools so that they can start eating properly. So if you have questions regarding that and you need some of those tools, you don't have those kinds of tools, let me know. We can talk about it. Get on the phone with me. I offer free consultations for people with questions like this. I will put the link to my scheduler in the show notes, but it's really simple. It's drmichele.com/schedule, and you can schedule a call with me, and we can make an action plan for you, or we can start working on your meal planning. Whatever it is that you need in this area, I'm here to help you, and I'm willing to spend the time with you to work on your plan. So let's get started on things you can do to start reversing your diabetes right now. And the first two things that we talked about today on reversing your diabetes related to your diet is choosing low glycemic foods and portion control. So if you get anything out of this episode, that's what I want you to get. Okay? So I will talk to you shortly. Bye. Today's show was brought to you by my coaching program, Beating Diabetes, the 10-Week Roadmap. For more information, head on over to my website, drmichele.com, and click on the Work With Me tab. All of the information is there about my group programs as well as one-on-one coaching. If you have questions about diabetes that you would like me to answer on air, you can email them to me. Just go to my website, drmichele.com/contact, to email your questions. And if you have questions you'd like to discuss with me over the phone, sign up for a free 20-minute coaching call at drmichele.com/schedule.